fact, winning isn't easy. Let's talk about a case example involving a breast cancer case and how one disability carrier screwed it up. But this is typical of what happens in a breast cancer claim and a disability claim. So I want you to understand the games that are being played. The case is Kersman versus Unum Life, and it serves, in my view, as a clear example of how disability carriers will often minimize or distort the realities of breast cancer recovery. Now, Dr. Kersman was an emergency room physician. She was diagnosed with stage 4 metastatic breast cancer, meaning that the cancer had already spread to her liver and her ribs. Her treatment included chemotherapy, a lumpectomy, hormone therapy, and a liver ablation. She took a full year off of work to focus entirely on her treatment and recovery. And when she returned, her oncologist approved her to work only 50% of her previous schedule with no night shifts. And that was done to help her manage her severe fatigue and to limit her exposure to infections. Now, having been in the emergency room many times, I know that it's a physically demanding and cognitively intense job. Every shift involves a very quick decision-making process, prolonged standing, and exposure to all sorts of diseases. Despite this, Unum initially paid her residual disability benefits for the reduced hours and then abruptly terminated them, saying, miraculously, she could go back to full-time duties. I want to talk with you about Unum's 5 arguments, because these are common arguments that we see in every type of disability claim, not just a breast cancer claim. So number 1, job misclassification. They incorrectly labeled the emergency room physician work as light duty. Emergency room medicine requires continuous high stress, high intensity performance, not only physically, but cognitively. Number 2, they discredited her oncologist. They claimed that her physician fabricated restrictions after benefits were denied, despite previously accepting those same restrictions. That's disgusting. Number 3, activity misinterpretation. They argued that doing yoga, doing light exercise, and taking family vacations were inconsistent with her disabling fatigue, disregarding the fact that this occasional light activity doesn't equate with working 12-hour ER shifts and is not the same physically or cognitively in terms of the demands. Number 4, they ignored treatment side effects. This is something I see all the time. They dismissed her documented fatigue, her nauseousness, her cognitive slowing, and the pain from the chemotherapy and hormone therapy. And number 5, they overlooked the infection risks. Now, again, this is one that disability carriers or plans will play. They will often ignore heightened dangers of working around contagious patients or in contagious situations where an immunocompromised person can ultimately contract something that can result in further illness or even their death. As I've said before, sometimes disability carrier or plans will say, well, this is an occupation that could be performed remotely and therefore you have no exposure. Whether they can say that or not really depends on the terms of the policy of the plan and, of course, the facts of each case. But that's the 5 games that I will normally see in a disability claim. Now, what did the court say? Well, the court sided with Dr. Kersman. The judge rejected Unum's reasoning, noting that occasional personal activity does not prove that somebody can perform the material and substantial duties of a high-demand medical role. The court found that Unum's dismissal of the medical evidence and her mischaracterization of her job were unreasonable, and benefits were reinstated. So congratulations to Dr. Kersman. So what are the key lessons here? 1, challenge wrong disability carrier plan job analysis. You want to make sure that the occupational classification reflects your actual duties and not some watered down version or an imagined version of what they may think the material and substantial duties of your occupation are. Number 2, ensure that your physician's statements are detailed. Medical opinions should directly connect your symptoms to your inability to perform essential job tasks. That's why we like to use that Social Security breast cancer residual functional capacity form, because it really highlights the functional, physical, and cognitive problems that most breast cancer patients and policyholders or plan beneficiaries will suffer from, as opposed to that generic APS form that asks questions that really aren't relevant. Number 3, explain your activity limitations. Now, if you are able to do personal activity like yoga, like taking a family vacation, you want to explain how you were able to accomplish that, what accommodations may have been required, and the price that you paid for doing that activity. You might have worn yourself out and be less functional or non-functional for a week, 2 weeks, or even longer. So you want to explain the activity limitations and how that activity impacted your ability subsequently to function. Number 4, document, please, every treatment side effects. Now, side effects are not extra symptoms. They are the symptoms that you are having not only as a result of your underlying medical condition, but as a result of the treatment. So I want you to think about them separately, but then I want you to think about them combined, because it's, in my view, the combination of these situations, these treatment side effects, and the underlying medical condition that explain why you can't engage in work and full-time work. Number 5, address workplace safety issues. If your immune system is compromised, working in certain environments can put you at life's risk, and you want to have your doctor comment on that. So what are the broader implications here? I think that this case highlights the larger truth that long-term disability claims for breast cancer often fail, not because you aren't disabled, but because the insurance company reframes the narrative. They create your own curated reality. They'll focus on snapshots of activity rather than sustained ability. They'll use incomplete job descriptions. They'll ignore the realities of cancer recovery. So proactive documentation, detailed physician support, and anticipating insurer tactics can be the difference between an approved claim and a drawn-out legal battle. And as part of that battle, we do need to understand that many times there are the disability insurance policies or plans, this mental nervous policy limitation that says benefits are limited to just 2 years if your disability is caused or contributed to by a psychological condition. Now, not every plan or policy has this contributed to language, but I want you to understand that that can play a role when there's a transition from own occupation to any occupation, or when they might have the ability to apply that 2-year mental nervous policy limitation. Obviously, and realistically, depression is part of the process of breast cancer and its recovery, its treatment, your reality. But we need to make sure that the medical provider is documenting that while you might have depression or anxiety, that does not contribute to your disability. So you can see that careful planning is really important in a breast cancer disability claim. Got it? Well, thank you for tuning in to this week's episode of Winning Isn't Easy. If you found this episode helpful, please take a moment to like our page, leave a review, and share it with your family and friends. And of course, subscribe to our podcast. You'll get notification when every new episode drops. I also want to ask you to make a comment, because I love commenting about questions that people have about our episodes, and I love featuring them in future episodes. So we want this to be a dialogue. Please join us next week for another insightful discussion. Thanks for listening.